Welcome to the Connecticut Health Policy Project's video primers on Connecticut's healthcare system. This first session is nuts and bolts. Your view of Connecticut's healthcare system depends on where you're sitting. Most Connecticut residents, 2/3 of us, receive our coverage through an employer, either ours or a family member's. 1 in 7 Connecticut residents is on the federal Medicare plan. 1 in 8 gets care through the state Medicaid or Husky program. Another 1 in 8 Connecticut residents buys their insurance coverage directly, and 1 in 11 of us has no coverage at all. Over time, seats in our healthcare system are changing. Fewer state residents are getting their coverage through an employer and more from public programs. From 2001 to 2011, employer-sponsored insurance in Connecticut, ESI, dropped 6.5 percentage points, while Medicaid coverage grew by 6.7 percentage points. These seats are not equivalent. Access to healthcare services and costs to both patients and the state are very different between private coverage and Medicaid. Coverage funded by taxpayers is rising in Connecticut. Public programs now cover 43% of us. Next year, with healthcare reform, about half the state will be covered by a public program. Now over 500,000 state residents are covered by Medicare, a federal program mainly for seniors and people with disabilities. Medicaid, a state program jointly funded with the federal government, covers almost 700,000 low-income Connecticut residents. The state employee plan covers 200,000 workers, retirees, and dependents. Healthcare in Connecticut is expensive. Healthcare spending per person in our state is 27% higher than the national average. Total employer-sponsored coverage in Connecticut is 9th highest among states for single coverage and the 5th highest for families. Unfortunately, Connecticut wages are not keeping up with rising health insurance costs. From 2001 to 2011, single premiums rose 72%. Family premiums grew by 85%. But over the same years, household incomes rose by only 23%. The quality of care that we receive does not reflect the high prices we pay for it. Only half of Connecticut adults over age 50 get the recommended screenings and preventive care that they need to stay healthy. Almost 1 in 5 Connecticut residents with asthma each year has to visit an emergency room to get care. And 11% of Connecticut hospitalizations, costing $1.2 billion each year, could have been prevented with better access to preventive care. In March 2010, Congress passed and the President signed the Patient Protection and Affordable Care Act. Meant to fix much of the inequity, inefficiency, and waste in the current system, the bill is 906 pages long. While it's been criticized for overly complicating health care, most of the structure of the system was in place long before the law passed. The law also includes something for everyone. Virtually any good idea to improve the system was included. The Affordable Care Act increases coverage to 32 million more Americans. About 200,000 more Connecticut residents will have coverage by 2019. The Act makes important reforms to our broken healthcare system, making coverage more affordable and more fair. The Act includes important innovations to improve the quality of healthcare, supports prevention and care coordination to reduce fragmented, wasteful care. The Act includes significant reforms to control skyrocketing health costs, including changing how we pay for health care. The Act moves away from paying based on volume to rewarding value and quality care. The Act stabilizes Medicare financing and eliminates the donut hole in prescription coverage in Medicare by 2020. The Act also reduces the federal deficit by $109 billion by 2022. The Act includes over 100 demonstration projects to improve the quality of care and make care delivery more efficient. The Act includes over $22 billion to support innovations such as medical malpractice demonstrations, research into the most effective treatments, and improving Medicaid payments to providers. Several important innovations are now improving Connecticut's healthcare system. Accountable care organizations, or ACOs, are forming across the state. Coordinated networks, including all the providers patients need, are providing continuous care and saving scarce resources. Connecticut State Employee Plan, run by the State Comptroller's Office, is improving the health of 200,000 workers, retirees, and their dependents. The plan is supporting the development of patient-centered medical homes to coordinate care with expanded hours and teams of providers dedicated to helping consumers manage their own health. The plan has also implemented the Health Enhancement Wellness Program that rewards members for getting regular preventive care and helps manage chronic conditions. Over 99% of members are getting recommended care, and it's working. ER visits are down, preventive care visits are up, and more members are taking the medications they need to manage chronic illness. Connecticut's Medicaid program is also leading in innovations. Last year, the program shifted from a capitated HMO-based expensive system that was not providing comprehensive care to a system that includes no incentives to deny care and strengthens care coordination. This shift is counter to national trends, but is providing the state with significant savings, better information, and improved access to care. Medicaid has developed supports and rewards for patient-centered medical home development and now includes about 900 providers in the program. Medicaid is providing thousands of medical practices with subsidies to purchase electronic medical records, making care more efficient and improving patient safety. The state has recently submitted a federal application to develop 5 health neighborhoods for people eligible for both Medicare and Medicaid. The neighborhoods will focus on patient-centered care for our most fragile state residents, and any savings from better care coordination and improved health will be shared back with the neighborhood. Connecticut's insurance market is also getting more competitive. In addition to our current short list of large for-profit insurers, 2 new nonprofit insurers are coming to Connecticut. The new insurance companies will offer consumers more options and foster competition to control costs. For more information and video primers on Connecticut's healthcare system, visit the Connecticut Health Policy Project website. For updates on healthcare in Connecticut, follow our CT Health Notes blog, and to track our state's progress in health reform, visit the CT Health Reform dashboard.